West Australians have been told that the so-called hard border is all about our health and safety. WA's Premier Mark McGowan is enormously popular in this state, due in no small part to his stance on that so-called hard border. But there are inconsistencies in the messaging from the Premier, who on the 1st of October told Perth media that there's no point in pursuing a travel bubble between WA, the NT and South Australia, not because of health advice, but because there is, quote, no benefit. He said all we'll do is lose jobs were we to open to those jurisdictions. He said the other states want us to open the border so that West Australian tourists will flood east, not so that people from the east will come here. They're only saying this for very self-interested reasons, because we have higher incomes, we have people more used to travelling, and therefore we'll have more tourists go from Western Australia to the east. Well, he subsequently tried to walk those comments back, and then this week, the state's Chief Health Officer, Mr Robertson, said the state could safely open to 5 of the other 7 Australian jurisdictions. And Dr Robertson revealed that the state government's all-or-nothing approach to reopening the border was not based on health advice, surprise, surprise, despite the Premier regularly claiming it was. I'm joined now by Opposition Leader Liza Harvey. Liza, good evening and welcome.
Good evening, Jane.
Now, I travel broadly around Western Australia quite a bit, Liza, and this hard border, this so-called hard border, because you and I know plenty of people come and go, not naming any billionaires, plenty of people come and go, but people think it's keeping them safe. The Premier has always said it's about health advice, but he belled the cat, didn't he, last week or the week before, when he talked about travel and tourism, and now we've got the Chief Medical Officer, Health Officer, sort of contradicting the Premier's line.
Well, the Premier's clearly been caught out here. Now, Western Australians, myself included, have supported the hard border because he said it's the direct advice of the state's Chief Health Officer. We found out this week through a parliamentary inquiry that in fact that's not the case. The Health Officer has given him a broad range of options, and the Premier has chosen the hard border option as the only one that will keep Western Australians safe. So, you know, there's very confusing commentary now about the border. Lots of Western Australians suffering overseas. They can't come home. FIFO workers who haven't seen their families for 7 months. We've got Just
tell us about that, because Paul Murray on Sky talks a lot about FIFO workers and how they've suffered. Tell us, give us an example of someone who, you know, who hasn't seen their family.
Yeah, well, my Facebook page is absolutely teeming with commentary from the FIFO community. There's one gentleman who's put a post up there that he hasn't seen his son for 7 months, which is half of his son's life. Another one, a lady from South Australia, saying that her FIFO husband hasn't seen his newborn baby. She's got 3 children, and he's not been able to come home to see that child. They need their jobs. You know, that they have to, they can't go back home to South Australia and then come back into WA without quarantining for 14 days, and it's just not feasible under the current arrangements. So, you know, we want the Premier to explain, you know, why is he cherry-picking the health advice? You know, we have... And
I have to say, Liza, on who he lets in.
Yeah, exactly, exactly. He's cherry-picking the health advice. There's lots of people coming in, but there's lots of people being refused. There's many people who've been told, who have had 5 attempts to get permits to come into Western Australia, and they're just, you know, there's rules for some and rules for others. You know, and the problem that I've got with this is that we have been misled. We have been told time and again by this Premier that he is acting on the health advice of his Chief Health Officer, who has said the hard border has to stay in place. Then we found out through a parliamentary inquiry, and the Health Minister confirmed it, that there are other options available that are safe, and that it would be safe for WA, for example, to open up to the South Australia and the Northern Territory. Now, this is really disappointing for so many families who are bearing the brunt of this hard border.
Well, we think that the Premier talks about it being April, so after the election. He knows this is a big winner. Do you think the West Australian public, I know that this is enormously popular at the moment, but do you think the West Australian public will cop that, the border staying in place until after the next election?
Well, it's pretty clear to me that the health advice is not the reason that the Premier is directing the border to be shut. It's very, very clear to me. He needs to come out and explain how the health advice can possibly predict that we need to be closed until April. I mean, the only reason for April that we can see is that there's an election in March, and that's really disappointing. So, you know, for all of the families suffering from mental health, suffering family separation, our West Aussies who haven't been to family funerals, West Aussies who've put their family reunions aside, you know, farmers who are ploughing their crops into the ground because they can't get skilled labour. You know, these are the ramifications of this hard border being in place. We were willing to wear that because we thought the Chief Health Officer had said this is the only way to keep us safe. So to find out now that the Chief Health Officer has put a range of options that he considers to be safe and the Premier's ignored them for the sake of his hard border is shocking.
What do you think should happen?
Well, I think the Premier needs to table all of the advice. You know, this is advice that doesn't belong to the Premier. The taxpayers are paying for this advice. No, we have called on him, table the advice, table all of the options that the Chief Health Officer has put up, publish them. Let's have a discussion about the options that we think can be safely managed. And, you know, the other question that needs to be answered by this Premier, you know, we've been virtually in lockdown in WA with our borders closed since March this year. Now, that's 7 months. Surely in 7 months, our state government agencies and our Premier and his ministers could come up with a way for us to manage our activities, manage more people coming home for Christmas in a COVID-safe way. And if they can't do that, quite frankly, you know, they need to turn that job and that solution over to people who can.
Yeah, look, I could not agree more with you, Liza Harvey, and I think that what happens really is that we have the politics of fear and that people think that that hard border is keeping them safe. In my view, it is time to open up the West Australian border, and I think that the Health Officer belled the cat this week. Liza Harvey, thank you for joining me.